I have worked so hard over the years to build some first aid kits that I thought would really take care of my family regardless of what happened. Well, I found out now because Aaron came. He is a medical disaster expert and a physician assistant, and he evaluated my first aid kits, and I found out that I'm not as organized as I should have been, and that the supplies that I have really aren't going to save my family in a real emergency. You're going to want to watch this and see the things that Aaron taught me that I need to change in my first aid kits so that I can take care of my family no matter what happens. Hey Provident Preppers, I'm Kylene, and today I have Aaron Asay with me, who is a military veteran who is going to help me go through my first aid kits and figure out what I'm doing wrong and how I can do it better. So Aaron, why don't you take just a minute and introduce yourself to our audience?
Thank you for having me here. I'm actually very excited to be able to talk about this. I'm not just a military veteran, I'm also a physician assistant, and I actually began my career in medicine as a firefighter paramedic. So I've been doing this for most of my life, decades. I've built first aid kits. I've treated patients all over the world in austere conditions. My specialty in the military is I'm a disaster medicine specialist. So I'm in the Hawaii Air National Guard, and I'm on a disaster search and rescue team. So your first aid, austere medicine, taking care of patients with very little improvised medicine, those are kind of my specialties. That's what I have sort of dedicated my life to being an expert at. I also work in the ER and CANAB. So my heart is in these rural communities, so being able to give back and be able to be in these smaller locations where healthcare is a limited resource. It's kind of not just where my heart is, but also where there's a lot of need. And so I like to spend time there. And that's also where I've sort of perfected my craft, which we'll talk about.
We will talk about. Okay, so now you can see why I'm so glad that Aaron is here with me today. And what I've done is I have gotten out my first aid kits, so that he can go over them, give me his expert opinion, and tell me what I need to do better. Because to me, first aid and having the resources that I need and the knowledge I need is really important, because we never know when disaster is going to strike. We never know when we're going to need it. So this first one that I have, Aaron, is a boo-boo kit. Yeah. This is the one kit that all my grandkids have access to. We don't let them have access to all the other ones. So you got Band-Aids
with dinosaurs on them.
We do.
Lots of fun colors.
I have little finger cuts. There's some butterflies in there. This kit is something that I have totally made up and have all the little things to take care of little cuts and things like that.
Which I think is great. First aid supplies are expensive. Going down to the medical supply store, and buying all the nicest things, you're going to spend a lot of money on first aid gear, and the majority of it is probably not going to expire. Although some things like adhesives can wear out, but you can also get a lot of these supplies on Amazon. Yeah. So, and there's absolutely nothing wrong with that. You do, kind of have the issue of quality. So recognizing what's good quality and what's not great quality, after you get it is important. But having all of your equipment in one place is extremely important. And you've done the right thing by building this kit. This is a great little kit, and I can't tell you how many of these I've made. Knowing where it's at, more importantly, knowing how to use everything. So, I'll give you an example. You've got these different types of, oh, excellent. What kind of super glue is that? Is this
just dollar store super glue.
Perfect. Yeah, no, that's great. So it's generally similar. As a medical provider, I have to tell you, you really should have like the real skin adhesive, right?
Yes, you should.
However, in a pinch, could you use this? Yeah, you absolutely could, and we do it all the time. So this goes back to the improvised medicine, right? The thing is with improvised medicine, if I plan to improvise, I've already planned to fail, right? And I'm not talking about the super glue right now. I'm actually just talking about medicine in general. If I'm planning on using, like, say, for example, an improvised tourniquet when I need a tourniquet, chances are I'm not going to be able to build that improvised tourniquet when the time comes.
Good point.
if I have the supplies to improvise a tourniquet, well, why don't I just carry an actual tourniquet, right? So, and I think a lot of people get into that mindset of, well, I'll just figure it out when it happens, or I'll carry this piece of gauze and I'll carry a pencil and, hopefully I can make back to the tourniquet thing, hopefully I can make one when the time comes. First aid shouldn't be an afterthought. First aid should be one of our primary plans. It should be right up at the top of the list next to food, clean water, security. So if we have planned to succeed in first aid and with medical problems, the chances are we're going to. So simply building a kit like this is a great first step. Knowing how to use the equipment is one of the most important things. So everybody has seen, these are regular Band-Aids, right? And this one is a Johnson & Johnson Band-Aid. These are really great. These have...
They're easier to open.
Yeah, they're a little bit easier to open than some of the Band-Aids, but here's one of the issues I have. So a lot of people use these Band-Aids that come in these the cheaper kits. They just kind of, you get like the free kit when you go, get your lube done or whatever, and people will take the Band-Aids out of those kits. Well, here's the problem I have is these are extremely cheap Band-Aids. There's no give, so if you put this on an elbow, because that's where your boo-boo is, that's not going to last very long on your elbow. So what's it actually doing?
Nothing.
It's going to come off, and now you're not protected anymore. Right. So I always try to get the highest quality Band-Aids I can find, and you've got a lot of different brands in here, so one of these might be... Here, let's try this one. Let's see if this one is any different. What is this? This is the Next Care Band-Aid. I think this is one that's like sold in like Target and stuff. So now this is a step up, and the reason I like this is because this one actually has stretchy material. So you put this on like a joint or really anywhere. The human body is not rigid. So you put it anywhere, and now you have a better chance of that staying on.
Oh, absolutely.
So I try to always have stretchy Band-Aids. I don't use I get rid of these. I throw them out of my first aid kits if I get one that has these in them.
I'm going to have to go through it. What a good point. Okay. Yeah. So I need stretchy and high quality.
With good adhesive. So when I'm testing a Band-Aid to decide if it's something I can use, I'll put it on my fingers and then I'll go work. And if it comes off while I'm working, then it doesn't meet my quality standards. So leave that on and see if it's still on after we're done talking, and then okay, those Next Care Band-Aids we're going to keep in our kit. There's different types of Band-Aids. We've got our big wide Band-Aid. So these are pretty straightforward. This one, it looks like it's a little bit older, but I'm not going to open it. But
we go through a lot of those.
I bet you do, working on a farm like
this. The knee scrapes.
So you've got a different kind of Band-Aid in here. So I want to pull this one out because I just want to ask you if you know what to do with this Band-Aid.
Well, I think that's my knuckle one, right? Yeah. So it wraps around.
Right. So I'll go ahead and open this one up because you should know all of your equipment.
It's interesting how hard some of them are to open. Seriously, I think I need to find ones that are just really easy to open.
we got stretchy material, so that's good.
Okay.
So I'll let you go ahead and put it on. How do you think that one goes on?
Oh, he's gonna. Oh, see, I can't touch the gauze. So I'm thinking I'm going like this. Am I doing it wrong? Am I doing it wrong?
Well, no, that works.
Oh. It's lousy. Look, it won't hold on at all.
So one of the things about adhesives, though, is if you can get them to stick, and this actually probably wouldn't be good for this spot. The knuckle Band-Aids go up here on your knuckles, or they can go around like you did down there. But if you can get them to stay on for more than just a few seconds, the adhesive actually gets more adhesive. It actually adheres.
Okay.
And so when you put it on, maybe even throwing like a little gauze wrap around it will actually help it stay on. This material right here, this is a lot like you may have seen it, the Tensoplast tape. It's a stretchy tape that we use in hospitals and stuff, but it's great as we call them plasters, over in Europe. The adhesive gets stronger over time, and it actually creates a fairly permanent bandage. So I don't know if this will do that eventually. It seems like it is that kind of material, but we're not going to test it right now.
So takeaway from my boo-boo kit is that my Band-Aids are too old. I might need a fresh supply.
You might want to refresh them.
Fresh
Well, let's
alcohol
test these. So here's alcohol wipes.
Let's see if they're dry.
Yep, they're still wet. So
Oh,
that's good.
Yeah.
So the most important thing about wound care is being able to get debris out of the wound and clean the wound, not sterilize the wound, but clean the wound so that you get any bacteria that may have gotten in after you got wounded. The most important part, because you don't use these to clean the inside of a wound. If you've got a cut on your arm, you're not scrubbing in there with alcohol or benzalkonium chloride. What you need to do is, here we've got some hemostats, so you could pick out any big pieces of debris, but most importantly is you take your syringe, and this probably isn't going to give you the force that you need.
So I need a bigger syringe in there?
Yeah, you need to be able to blast clean water, and you can use regular soap and clean the wound out. So a few times of that. So what I like to do actually is I like to have iodine swabs. I think I saw one in here. You have one. So I don't see any others, but you do have one. So that's good. Just opening this iodine swab and dropping it in a bowl of clean water, even tap water, will give you a solution that you could clean a wound out.
Ooh,
you could also just use regular soap. So that makes these actually totally unnecessary. What do I use the alcohol swab for? To wipe all the oils off before I put the Band-Aid on, so the Band-Aid actually sticks. That's about the only thing. The benzoyl chloride is also for cleaning or prepping a wound space. So you don't want to use it inside the wound because it's just as bad on your healthy tissue as it is on bacteria. So washing it out with clean water and some soap, if you have it, has actually been shown to be the best way to clean out wounds.
Okay.
You're right. This is actually a great boo-boo kit. You've got tons of Band-Aids. The thing is this is going to be in one place. It's not really going to move, right? So it's just going to sit up on the shelf. And if you get hurt someplace, you're going to have to go get it, take it to that place, or bring the patient to the kit and clean it up, which is great. This kit would be designed for that. So taking that perspective, all of the emergency kits, all the first aid kits that I built are purpose-built, meaning they have a reason for existing, and that's a scenario where I would use them in. So for this one, this would be a great kit to have in the kitchen or to have in a workspace, right? You can get in it and get your Band-Aids out and get your syringe out and clean off the wound and pick little things out. You've even got tape in here so you could put a bigger bandage on if you needed to. And that's great. But what if you needed more supplies? What if you needed to have this on you when you're not in your kitchen or you're not in that place of work? So this is not something you're going to throw in a backpack. It's not something you're going to have, on your person. Could you jump in here and grab a couple of things and shove them in your pockets? Yeah, you totally could.
But we're going to talk about that, aren't we? About how to be prepared. Okay, so this one, I need new Band-Aids, and we understand that it's a boo-boo kit. Like, it's here for my kitchen, it's here for my grandkids, and then we're going to move on because we got more to talk about.
Or what we would also call a minor wound kit.
So that was my boo-boo kit, and that stays right here in my kitchen. Now, I have 3 of these that are identical to each other.
And where do you keep them?
And they're actually kept downstairs in my storage room, because this is for my bigger stuff. Okay. One of them has the first aid book in it. Okay. The rest of them actually don't. Okay. So. Lots of good information here. I know you've memorized it, so tell me what's on page 67. I have memorized every bit of it. Okay, so if I am getting this kit, why am I going to this kit versus going to the boo-boo kit? So what was your purpose for building this one? To keep my supplies organized, for one, but so that if somebody has a bigger injury than the boo-boo kit, like this has a SAM splint in it, so if I'm going to need to splint something, but this is all meant for home. Like, this isn't something, well, actually sometimes when we go on family vacation, if we're camping, I'll just take one of these kits and put it in there. But for the most part, it's my life is falling apart. I want to make sure I have what I need. Okay, well, you've done a great job. You've got your kit is organized. You've got wound closure baggage. You've got your gloves all in a baggie. This is probably another triangle bandage. Yeah, homemade. So I cut up my old sheets. I wash them. That's awesome. It's essentially all this is. I mean, this is actually great.
So I wish more people would do something like that.
That's
That's not cheap, that's resourceful. Let's see. Okay, we've got some saline, eye saline. So now we're talking. You could actually do some legitimate irrigation with this. You can actually use this like you would a syringe. So, you take this top off, it's already designed to have a little force. So the eyes are no different than a wound. So you probably would end up using 3 or 4 of these. So having more of these, but you can't carry 3 or 4 of those around. And so I didn't even include that many in our kits. The reason being is this is to begin the process. And then I collect other things while I'm doing the job. So if I'm irrigating eyes, I have a plan for getting more irrigation, but I can start the process with what's in my kit that I have handy. This is awesome.
My emesis bag?
It sucks having to deal with vomit all over everything. So you did a great job there. Some masks, and here's your SAM splints. So these are all very handy things. These are your bandages. So do you use these to tie the SAM splint on?
Yeah, the roller bandages.
Yeah, you've kind of got an orthopedic care kit, a small wound kit, some cleaning. Is there an eye shield in here after you do clean the eye out?
I don't have an
we
eye
found
shield.
the hole. There isn't an eye shield.
I don't have an eye
hand
shield.
sanitizer is great. So yeah, what's in here?
Those are little medical tools.
Okay, great.
So that
Very
it's
handy.
just all there and ready to go.
Anything for taking care of dental wounds? I don't see
There's
that.
not. There's not.
Very
Another
common.
hole.
Yeah. But no, all in all, great job. This is purpose-built, and you have multiple. They were very inexpensive to build, so there's nothing wrong with anything that you've put into this kit. I would probably have the same things. So scissors are awesome, but you can also get trauma shears that will cut through clothing, which these may not. They may not get through really thick jeans or the seams.
I don't think they will.
But you can get it for the same price as what you got this. You could probably get a trauma shear on Amazon and do the exact same thing, but have a more robust. They cut through pennies. Okay. So just to give you an idea, if you need to expose something very quickly, I would actually get a trauma shear in this kit. But otherwise, you got some finger splints. So you do actually have a quite complete kit. Now, if I needed to get to the finger splints, I have to unpack
all of it.
Everything. There's my finger splint. So that would be the only thing I have about putting them, the only issue I would have about putting them in tubs. There's nothing wrong with it, especially if it's a home-based kit. Carrying this somewhere, these plastic tubs and bins tend to get damaged. They crack, and that can allow moisture in and things to fall out. So just some things to think about. But in a pinch, and especially if you're budget conscious, putting a kit together like this is actually great.
So now one of the professional kits that I had bought, I did this intentionally because when we did I'll let you look through this one. Okay. When we interviewed with Nick Miller, he talked about how important chest seals were because he had done a whole thing for us on exactly what we should have in our first aid kits, trying to help us do better. And the chest seals were one of them. So that's why we got this one. Look at it and tell me what you think of this one. Okay,
so first of all, if he's telling you that you should have a chest seal, that tells me that the kit is probably a trauma-based kit, what we call in the military an IFAK, or individual first aid kit. If it's a trauma kit, so like I said a minute ago, it's important to know the purpose of your kit, which gives you the limitations or the barriers of what the kit can and can't do, right? So if I have a chest seal in my kit, that means I'm treating life-threatening injuries at the moment of injury. If somebody needs a chest seal, it could be from a stab wound, it could be from a bullet wound, or any other penetrating injury, really. That means they have a sucking chest wound, which means they have a penetration into the lung, which means they will die most likely if they aren't treated, meaning if you don't put the chest seal on, right? That would be a situation where time is of the essence. So I'm going to want to have a kit that is laid out, very organized. I'm going to want to know where that chest seal is and be able to get to it very quickly. I'm probably going to want to have other things in that kit as well, including a tourniquet, including a compression bandage, because not all penetrating injuries need a chest seal. Many of them need other interventions, right, in other parts of the body. The chest seal is only for this area of the box where the lungs sit. The chest seal doesn't do us any good in in the abdomen or on a leg, for example. The chest seal is not going to stop the bleeding. So if I'm carrying a kit with that in it, that kit needs to be specific for that purpose. So if I'm opening this kit and looking for the chest seal, and the first thing I see is saline wash, a light stick. All right, so you're having trouble breathing right now.
Organization.
You're about to die because you've got a sucking chest wound, and there's my gloves, so these would be handy. I'll use those right now. Here's some gauze. That's not going to do me any good. I could fill that hole with gauze. So if you put gauze into a sucking chest wound, do you know how much gauze you can put in there?
No clue.
All of it. So it doesn't matter how much gauze you have, it will all fit. So meaning you're replacing the lung space with gauze, right? So we don't use gauze there, nor do we use Band-Aids. So we have a compression bandage, but this isn't gonna work there either. So I finally found something that could work on a life-threatening emergency. A compression bandage could potentially stop the bleeding with pressure, but where is my chest seal? On this page, we do have a couple of chest seals, so that's good. This kit came with 2 chest seals, but I had to look for it, right? Mm-hmm. But now I need a tourniquet. So if I've got chest seals, there's got to be a tourniquet, because these kits. Okay, so we got the rat's tourniquet. I'm sure your audience knows what the rat's tourniquet is. So this is a type of tourniquet. There's pros and cons to having just an elastic band as a tourniquet, and there is some controversy over how effective these are. But do you know how to use the rat's tourniquet?
I have done it in first aid several times, but if you were to ask me to do it right now,
put it on right now?
I don't know.
And we do have some quick clot. So my emergency supplies, my life-threatening injury supplies, we have an airway, we have chest seal, compression bandage, some gloves, some gauze. Okay, we'll include this too. A CPR mask, although that's usually not included in kits like this. Okay, so this tells me, and then for hypothermia, here's what's needed for that event.
Space blanket.
Yeah. Here's what's needed for that event. All of this other stuff means that this kit is, there's rope. It's a jack of all trades, master of none. This kit isn't sure what it wants to be. Is it a first aid kit? Is it a life-threatening injury kit? Is it a boo-boo kit? It's kind of got, is it for dehydration? It's kind of got a little bit of everything. But I have to sort through all this stuff to find my life-threatening supplies. So me personally, I would create a kit that has this in it, or I would have this kit have all of that in one spot. And then if I'm going to put other things in it, I would put them other places out of the way. Here's your trauma shears. So these are great, but they're stuck way here in the back. And if I'm trying to expose a wound, this was behind all of this other stuff.
Before we put that away, one of the other things that I have, and I know we're talking about Jase here, and we're talking about the Jase Aid Kits, but medication is huge. And so this is the Jase case. But this is one that I had specially done with a whole bunch of add-ons. I've got a whole bunch of stuff just specifically that I think is important for me, so that I have whatever kind of medications I need, especially the emergency antibiotics.
Yeah, and that is wonderful. In the event of any kind of disaster or crisis, one of the first things to go shortage is medications. In fact, oftentimes, and I can tell you this from experience, when I work in the field going to disasters, there's often plenty of food, and people can go without food for quite a while. You can often find even clean water. Most of the time, there's you can boil water, especially if you're talking your local community. But medications, there's no improvisation for medications. If you don't have them, you don't have them. And if you need medications, in the event of a disaster, you need the medications. It could be life-threatening, especially things like antibiotics. Yeah. And this is what we found is, when we deploy to disasters, bringing those medications with us oftentimes are the most valuable resources that we have that we can supply to those locations.
Now we're going to talk about the Jase Aid cases that Aaron has created. Like, I'm totally excited for this. Show me.
Thank you. I have been very lucky to be able to work with Jase Medical. They asked me to design first aid kits that would be something that I would use either in a military setting or as the executive director of Jase Response. I deploy all over the world in the United States and internationally to disasters. That's our specialty, is we take the resources that we have access to, which with Jase, it's the medications and first aid supplies. And we take those to disaster areas, hurricanes, earthquakes, tsunamis, you name it. Because of what I mentioned,
That's so awesome.
The medications are, the first thing that there's a shortage. So we try to create that access in those locations. Most recently, we took medications down to the fires in California. We've been helping with people in North Carolina, and we just sent some of our kits to Ukraine. So we try to take all of this equipment that we kind of take for granted here in the United States to places that just don't have it. So I designed our version of a boo-boo kit by building what I think is kind of the perfect version of it, something that you could throw in your pocket, throw in a backpack, throw in your purse, and just always have it with you, right? Now, this is not for life-threatening emergencies. We'll get to that kit in just a second. This kit is designed to take care of it's kind of like your boo-boo kit that you had when we first looked at it, right? It has Band-Aids in it. So we've got very high-end Band-Aids that actually I designed.
Your Band-Aids stick?
They stick very well, yeah. These Band-Aids are even labeled with the Jase logo, right? So they are custom made in that regard, but I specifically chose these because of their adhesive qualities. And they're also stretchy, like I mentioned before. And there's all the different varieties of Band-Aids. Now, you might ask, well, how come there's so few? So this kit is not designed to sit in your kitchen. This kit is designed to be with you. You should not have to run back to your kitchen or back to your truck to grab what's in this kit. This should just be there available. So if you need a Band-Aid, you have a Band-Aid. When you have an injury and you open up your first aid kit, when you go home, you should be thinking about, okay, what did I use in my first aid kit, and restocking it, as opposed to having something that's just available for 100 different injuries, and then when you're out, you get a new one. This was designed to be refilled. So if you use the equipment and it's dirty or it's used up, then you replace it with new supplies, so that you're not having to carry around a whole bunch of things that you just don't need. So yes, I can take care of a lot of boo-boos with these Band-Aids, but I also we talked about irrigating a wound.
Oh, you've got a bigger syringe.
So I actually have, a full-size syringe that's designed for irrigating wounds, so you can really get in there nice and deep. So, and like I mentioned, you take your iodine prep pad, which I've got 4 or 5 in here, plus some alcohol swabs if you need to clean off oils to get some stickiness from the adhesive. But you drop this prep pad into a little cup of water, and then you just draw up your solution, and now you can irrigate that wound, right? You can also use our Q-tips, which I've included the Q-tips that have the iodine in them. So I can use the Q-tip directly into the wound to clean, or I just break open the Q-tip and drop it in the water, and now I can use that Q-tip to help clean out the wound. And it also creates an iodine solution. Taking care of small wounds, though, is only one aspect of this kit. So once the small wound is cleaned, debrided, you've gotten all the little pieces out, there's different ways to close it. So you can use a Band-Aid. I actually have a zip stitch, which this will actually close lacerations. So we also have the wound strip closures. Closures, these are like a high-end butterfly. So we do have butterfly Band-Aids, but these steri-strips you would use with an adhesive like Mastisol, which we have in here, and you would actually create a closure that's almost as good as using sutures.
So if one of my kids got a nice deep laceration, I have everything I need to clean it and to close it really well until we can get help.
Yeah, and if you're in a situation where help is, days away, you may not even need to go get help. You could, if you clean it appropriately and you have access to antibiotics if you need them. You may not ever have to go see a medical provider. Okay. These zip stitches, these are fairly new, you know, in the last 5 or 6 years. This is a ultra adhesive bandage that also has this mechanism that's kind of like a zip tie, but it takes the wound and it pulls it together. Yeah.
That's awesome.
And you're done. We also have duct tape, which for me is the multi-use for everything, even bandaging. Especially duct tape is awesome for blisters. And there's a great way to use it for blisters. I actually included it. We have these cards which show you how to use the supplies that are in here. And I am actually in the process of building more of these so that the kits will come with more and more information as to how to use everything that's in the kit. Which
is huge. It's just so huge, because even me, who's taken, I can't tell you how many first aid classes over my life, sometimes I get there and I'm like, wait, what am I doing? What am I supposed to do?
Yeah, and you know, in this day and age, it's hard to remember things. We all carry around our peripheral brains, you know, with our phone and whatnot. So even just having, I know this works for me, even just having the information there, I can look at this wound cleaning and then it triggers that memory. Oh yeah, I've read this card. I remember now, you know, so just having those triggers sometimes is all it takes.
And I like that they laminated. They're really rugged. Like I don't think I could hurt them.
We also have some other ways to bandage. I really like Coban dressing. You know, this is like your horse wrap type thing. All of my kits have trauma shears in them. This will cut through, like I said, cut through pennies. So if you need to get through some very thick clothing to expose the wound, you can. But you can also use this to make improvised devices. So if you need to cut up clothing to make strips for improvising bandages or ties or things like that. This kit also has a little light if you happen to be working in the dark.
Oh, that's kind of clever, actually. Because you've just got it chained right in there. Yeah.
I didn't overwhelm this kit with a whole bunch of gauze. In fact, because this is only designed to take care of a few boo-boos, just one gauze bandage, and then you just replace it. When you get home, you go to your other kit and you put another gauze bandage in there, 4x4 dressing. This kit also has a Jase exclusive. This is the OTC Med Pack. So this is all of your
OTC
over the counter. Yeah. So you've got Tylenol, you've got an antacid, you've got some Pepto-Bismol, a Benadryl, all in this little pack. There's I think 7 or 8 different medications in here. So this kit only has the OTC. When I get to the other ones, we'll see what Jase has done to include medications as part of the kit. But having something to control pain when you travel, this is a great kit, because if you've got some stomach issues, some diarrhea, there's loperamide is in here. You know, that's your diarrhea medication. You've got some
and actually the Benadryl. Okay, so that is huge. My little granddaughter, we just realized that she has a nut allergy. When we went on vacation, she had some cashews, and all of a sudden she just, like, her tongue was itching and she had hives, and she was just, and we're like, we need Benadryl, right? I think now I'm thinking everywhere I go, I need to make sure that I have Benadryl. So it's great that it's in there.
Which is why I included it here, because this is, I don't plan on having the Benadryl always with me, but now I know that I do have an emergency backup. So this is one of those, like, I do kind of plan to improvise, but I'm not improvising. I'm actually prepared because I have it in this little kit.
Good point. Good point.
And this is just more dressings. I did include also in this kit a hydrocolloid dressing. So these are specifically for blisters. So yeah, you can trim this to the blister size, stick it to the blister. You can either use duct tape or one of the Band-Aids, and it creates a dressing that's moist, and it helps take care of the blister area. So this is kind of the newest way to deal with blisters. So we also have some mosquito repellent, which if you need mosquito repellent, it's because you forgot, and there just happens to be a couple in there. But we also have some Sting Ease, some hydrocortisone for itching, and also how to take care of nosebleeds. So this kit specifically, I've included a nose clip. So, if you've got a nosebleed and it's not stopping because you're leaning forward doing this, you can just put this on, leave the person for 15 minutes and see if it stops. I also, I don't have the card in here yet, but there's instructions that will be coming in how to make a nose clip if you need another one out of your tongue depressors. So epistaxis, or nosebleed, is another one of the wounds that this can care for. And there's a little mini splint, so a finger bandage. So you can kind of see how it goes beyond the scope of just a boo-boo kit and allows you to care for some of the things that really could be detrimental. Say you're traveling, say you're out in the field, say you're just away from everybody and everything. This might keep you from having to stop what you're doing and travel long distances to go to a doctor.
Oh yeah, and it's small enough in there that it's portable and organized. That's awesome. So this was the Jase Mini.
Yep.
Okay, now tell me a little bit about the case, because obviously there's a lot of thought that went into that.
Yeah, these are not off-the-shelf cases. And, you know, as I mentioned, the organization of your first aid kit is very important. So a lot of time, a lot of energy. This was a labor of love building this kit. I built each of these pockets, the elastics even, specifically to hold equipment in a certain place and to create a organized experience. So when you open this up, you recognize all of your gear, you see it laid out before you, and you can say to yourself, I know exactly what I need. I'm going to grab that and I'm going to get to work cleaning up this wound. I'm ready to go and do what I need to do. A lot of kits aren't designed that way. They're built haphazardly, you know, even down to, I made a spot where you could put your garbage when you're done. So this is actually made with stretchy material on the front. Oh, here's the other thing is, this is a requisite for my first aid kits, all of them, is you have to be able to pick it up, turn it upside down, and have nothing fall out.
Awesome. I love the pocket in the front, because if I needed to, say, take an EpiPen or an inhaler,
yeah, albuterol inhaler,
I have
any
a
extra
place
gear you got
to make sure for whatever is my specific need that I can add to that.
Yep.
That's awesome.
Exactly.
So this is the trauma, right? It's the trauma kit.
This is the pièce de résistance. This is what started it all, because I personally feel like this should be in everybody's car. I feel like it should be in every office. I feel like one of these should be everywhere. We live in a world that's dangerous. The risk of having a life-threatening injury, a penetrating injury that involves massive bleeding, that involves an airway issue like we talked about, you know, with needing the chest seal, a sucking chest wound, or bleeding from one of your extremities from an artery. Those wounds, people don't need to die from those things. We have lots of interventions that we can do to help those things, and if done correctly, will save a life. And we know that, the studies show that. So this was designed to fill that hole. The first thing you notice when you open up this kit is everything that you might need. Now, personally, I unwrap all of my gear. So I prep my kits by taking the packaging off the tourniquets, by taking the packaging off of the compression bandage, because when my hands are bloody, it's hard to get these packages open. So they're on here they're in here for shipping, and this is a new kit you just got, but I would recommend, you know, take your tourniquet out of the plastic and put it in your kit in such a way that you can access it very quickly. And I'm just showing you right now how hard it is to sometimes get these open, right? They're actually right here. So you can grab those. Easy to find.
Easy to find. You knew right where they were.
Yeah. So this is how I would actually store my tourniquet, and this is what I tell in the instructions, what I tell people to do. And I designed this one in such a way that you could actually, you don't even have to put this particular tourniquet. We use the Snake Staff ETQ, one of my favorite tourniquets, because it's very small. It's a windlass tourniquet. And it's easy to tuck away. You can even carry this on your person, and you'd never know that you had one of these in your pocket. I'm prepared for any eventuality of a massive hemorrhage, and I'm prepared, right? So I also designed this one so that I don't have to put it under a strap. I can actually grab it because we put Velcro in the back here. Most of the tourniquets have some sort of, I said Velcro, it's hook and loop. So sorry about that. But you can do that, or if you want it to be more robust, you know, safely stowed away, you can stick it in there. But again, it goes back to what I talked about.
Is it gonna fall out?
I can open this and nothing's going to fall out. So there's a few pieces of kit in here that I really, really like. it's got all of the components for following the March algorithm. March is the process that we use to take care of a patient that has life-threatening injuries. And it's becoming more prevalent in the civilian space as well. And March stands for massive hemorrhage, airway, respiration, circulation, head hypothermia. So it's MARCHH, basically. So massive hemorrhage, tourniquet, compression bandage, hemostatic gauze, which is the gauze that causes blood to clot. We don't have to go into that, but there's ways to use this gauze more effectively in wounds. And also, going back to our conversation about knowing all the gear, you should know everything that's in here, how to use it, when is appropriate to use it, how to effectively pack a wound. So getting that training when you get one of these kits is imperative.
Now,
however,
you guys are working on educational videos for those, right?
We are. Not just videos, but I also include in this kit, just like in the other kit,
the cards. Yes.
Yeah, cards on how to use it. But I sure hope that if you're having to put on a tourniquet, you're not going to find a card. And okay, when last tourniquet use, place high and tight on the limb.
Where are my glasses? Where are my glasses?
So, but no, they are there. So you will have read through this before and you'll look at that and be like, oh yeah, I remember. And get to work, right? So we also have, here's the March trauma card that goes through the March algorithm. So it's a great opportunity to learn. If you haven't read through it yet, you should. But going back to your gloves, which are the first things that you grab. Again, I usually take everything out of packages and put it in my kit. Battlefield trauma, civilian street trauma, there's nothing sterile about that environment. So thinking that you need to have sterility, that patient is going to end up on antibiotics no matter what. So the best thing to do is to have all your equipment handy, ready to use, put on the gloves really fast, apply pressure, get the tourniquet on, and don't worry about it. You're not throwing dirt into wounds. Right. You're not going to put your hand in mud and stick it into a wound and pack it, right? If you drop your gauze into the mud, maybe you want to grab a new gauze, but it's not a sterile procedure. You're not laying out a nice little mat and cleaning off the wound. And you understand what I'm saying?
Absolutely,
but people get so caught up in that. I take my gloves out, I roll them up nice, put them where I can grab them quickly. There's a couple pair here, and I can just reach down and grab them and put them on.
So you roll two into the one.
Yeah.
So you're grabbing a pair.
Yeah, or I might take a little piece of a rubber band or a piece of tape or something. I designed these so they'll hold them actually really nice. The Slishman wrap. This is a fairly new device. It's a compression wrap. It's basically an ACE bandage with some hook and loop on it. So using it as a compression bandage or a makeshift tourniquet, you can apply this to an extremity, and I'm just showing it on my forearm, but this goes back to that rat's tourniquet that I was telling you about, but this is sort of a different approach to it. So for one, it's really long, so you get increasing compression with each wrap. And also, as the wound expands and contracts, you have the same pressure being placed on the wound. Whereas when you have something that doesn't stretch, like most of the tourniquets that are on the market today, you actually do have changing pressure in that body cavity. And sometimes that can cause the tourniquet to fail. So I'm not saying this is a tourniquet. This would be an improvised tourniquet if you did use it as that. But if you did need to use it as an improvised tourniquet, it actually is possible to make this into a windlass tourniquet by using the tools that you have, if you needed to. For me, I use it for all kinds of different things. I can make a sling out of it. I can do a compression wrap. If I don't want to use this bandage, I can easily throw some gauze in and then put that over the wound and compression wrap it. That's actually what it was designed for initially. But the Slishman wrap has also held on snow chains. It was an ACE bandage for my knee when I slipped hiking the other day. I've used it to hold my skis together. So a very useful piece of kit. Yeah, I always carry one of these on my person all the time. If you look in my bag over there, I've actually got a couple. So you've got your chest seals. There's two, like we mentioned before, and your airway. So do you know how to put in an nasopharyngeal airway?
I do not, and I would really rather you didn't put it in me right now.
Yeah, so I've had one in. I put it in myself, and I also allowed one of my
fun?
co-students to do it. And I fortunately don't have much of a gag reflex, so it wasn't that big of a deal. But most people don't know how these work, but they show up in a lot of kits. So thinking that if somebody needs a nasal airway and I'm gonna know how to do it if I've never done it before, means I'm likely going to either harm that person, put it in wrong, or not do anything for them and just waste time. So it goes back to being really important that we know what's in our kit. Get the training on it. It also comes with some lube, so that should give you an idea of what you do with the nasal airway, right? So that's the MARC, so massive hemorrhage, airway, respirations, and circulation. Now if we flip this over, we've got an extra abdominal pad, and then I've got the head and hypothermia part. So head injuries, sometimes eyes are involved, but having an emergency blanket in your kit is super important, because when somebody has a traumatic injury, there's what we call the lethal triad, and actually it's called, we've expanded it to the lethal diamond. I'm not going to get into the science, but when somebody gets cold, when they get injured and cold, their body doesn't clot as well. So keeping them warm will actually help the bleeding stop better. So keeping them warm is imperative, so that's part of the algorithm. So when you get down to H, you've taken care of the patient's wounds, now you're just waiting for transport, or you're waiting for the paramedics to arrive. Getting them wrapped up in a nice, what we call hypothermia burrito. You can start with this to eliminate some of that heat loss and help the patient hopefully survive better. And then we also have a burn dressing. So as far as this kit goes, what actually sets it apart though from everything else, because these are all the basics, and there are other IFACs on the market that are fine. There's some that are sold by the military, companies that cater to the military, and those are actually built very similar, because this is what I carry in the military. However, Jase has included in these kits, and if you get it through Jase, you can also get the trauma pill pack. So this is what, in the military, we called it the combat wound pill pack. And basically what it is if you have a penetrating injury, this is your first dose of antibiotic, moxifloxacin. It's also pain relief. So it's meloxicam, which is an NSAID, but it's an NSAID that doesn't have the same side effects as like ibuprofen and naproxen, which can be an anticoagulant, meaning it keeps the blood from clotting. Meloxicam doesn't quite have that effect on the blood, so it's safer, and Tylenol. And then if you have some nausea, you can also take the Zofran that's in here, or ondansetron. So these are prescription medications that up until now have only been available to the military, but now they're available to civilians.
When I got this from Jase, I had to actually go in and do the little survey thing online and have a physician go over that. So that was super cool.
Because they are prescription medications. So they're not available to everybody. You can't buy them off the shelf. You do have to go through that process, and these are prescribed to you.
What a great kit. Now my job is to learn to use it. And I can do that. I can do that.
You can do that. You should do that.
I should do that. Okay, now we're gonna move on to this one. Okay, Aaron, those were super cool, much more organized than mine. But now we have the granddaddy. Tell me about the Jase Medic.
All right, so the Medic actually came about from our humanitarian deployments. So I wanted a bag that could be versatile, that could be changed up for different environments. And I mentioned this already, but when I design first aid kits, I make them purpose-built. So I have hundreds of different types of first aid kits, from little bags to big bags, and designed for the mission, right? So I designed the Medic for the purpose being a changing mission. I wanted something that could be discreet, that could look nice in any environment, but also be durable enough that it will hold up to the rigors of wherever we happen to be. If I take this into the field in a disaster, I know it's not going to get torn. It's not going to, the zippers aren't going to break.
No, it's a nice bag.
It is. In fact, I'll admit it's a little bit overbuilt, and I kind of did that on purpose. But Also, the inside is modular, so I can change it up if I need to. So if I go on a humanitarian mission, it might look a little bit different on the inside versus what I have designed for Jase customers, which is basically being a gigantic boo-boo kit. It's sort of a oversized version of the Mini with some expanded capabilities. What's really cool about it is this kit was also purpose-built to be able to hold your Jase case. So, and you've got the little Jase case. The newer one is a little bit bigger than this, but it's designed to fit, and I'll show you where when I open it up, but it's designed to fit in there and keep all of your first aid supplies plus your emergency medication. So if you had to leave your house, for example, and you're grabbing your go bag and
you're ready to go.
Whatever, you could also just grab this. And you've got everything you need medically to take care of yourself for however long you'll be gone.
That's a great idea.
So we'll just start with the front panel. This is your evaluation kit, or where all of your diagnostic tools are at. It's also where I put the medical cards. So this one has all of the cards that were in the trauma, plus the cards that are in the Mini. So if you need a prompt for your brain, but we also have a pulse oximeter.
Okay, which is huge. The pulse oximeter, like I have a little granddaughter who has asthma, and I actually keep one of these in my bedroom, because when somebody's really sick and you don't know what's going on, if you can tell whether or not they're getting enough oxygen, it rules out so many things, right? And if this is low, we're off to get her meds, or we're on our way to the emergency room. So,
and honestly, your pulse oximeter, your thermometer, and your stethoscope, really, that's all you need for diagnostics to decide if your family member, your patient, needs to go see a higher level of care. People have asked me why I didn't include a sphygmomanometer, or the blood pressure cuff, in this kit. The reason being is, one, they're really bulky, and two, somebody who needs a blood pressure cuff probably already has their own, and it's nicer than the one that I would include in this kit.
That's a good point.
Oftentimes when I deploy, I don't even take a blood pressure cuff. I can figure out somebody's blood pressure, or at least if they have enough of one, without using a blood pressure cuff. But I can't tell somebody's pulse oximetry. I can't tell how well they're oxygenating without that little tool. And I want to know what they're breathing. If their pulse ox is low, then I'm going to listen to breath sounds and try to figure out what's going on. But again, the blood pressure is probably not going to help me. At least there's not enough bang for the buck for me to include it and have to replace something else that's in this kit. But what I did include in this kit, which is not found in other kits, this is an otoscope. So this is for checking ears, kind of like the Dr. Mom, which is
huge.
Yeah, kind of cool. I love otoscopes, and the whole ENT, especially if you've got kids around, being able to see if somebody's got an ear infection is a big deal, especially because you can treat it. You can start them on antibiotics. But we also have this little toolbox, which includes dental tools, which most kids don't include. So we also have some dental putty inside the kit. So one of the things that will stop a fun time faster than anything is a dental injury. So if you break a tooth or expose a nerve, you're done. You are in pain the whole time, and all you can think about is your pain. So this allows you to do an assessment of the mouth, of the teeth, and also there's a little burnisher so that you can actually apply the dental putty. There's a little mirror in there so you can see what's going on, and take care of minor dental emergencies and decide just when to go to the dentist. Is this emergent, or can I put it off for a little bit because I've got some putty and I can seal up this little wound. So
great idea.
So this was, we call it the Jase toolbox. So this again was something I designed specifically for this case. And then we've got our own version of vomit bags.
That fit much better.
The Jase vomit bag,
face.
And you can even leave your little Yelp 4 stars. And that should go without saying why there's a vomit bag in here, because when you need one, you don't have one, right? Yeah. So this way you do have one. Now we'll go to the center of the case, and what you're going to notice when you first open it up is that it's very well organized. However, this little collapse part right here is because it's missing a very important component, and that is because that's where the Jase case goes. And that actually is what gives it a little bit of more structure. However, I also designed this that if you don't happen to have a Jase case, let's say you haven't, or maybe you don't want to keep it in here, or because it's something that you have chronic meds and you get in and out of them periodically, or you don't have one yet. I actually designed this kit to be able to house a trauma kit, so it fits where the Jase case would go. So if you want to have a complete kit that covers everything from medical problems to trauma, then you just put your Jase trauma in there, so you combine those together.
Great idea.
So, yeah, kind of cool. Now back to what's in the kit. We'll start here on the outside. I put tools so they're easy to see. So if you need to irrigate a wound, if you need to pick things out, your gloves, one of the first things that you would grab if you're taking care of wounds. Some tools like scalpels, I love safety pins. I use safety pins for a lot of different things. Improvised medicine, but I use them for a ton of different things. Limited by your imagination, really. And then up here, we've got all of our bandaging supplies. So on the left here, we've got your eye shield and your nose plug and some tape, and then just a whole bunch of horse wrap in our wonderful Jase green, and then bandaging supplies. So this is just an expanded set of what would be in the mini, and some bigger ones. So you could take care of larger wounds and more wounds. So if you've got this and a mini, for example, you could replace what you took out of your mini by getting in here and just moving supplies from one to the other.
So that has the little zip, what do you call it, the zip closure?
The zip stitch, yeah, but that's in a different spot. So this is just for covering the wounds. So on both sides, if I've cleaned the wounds out, and now I'm just putting bandages on them. So, you've got your elastic gauze. I've got some bigger dressings back here. I've got the Band-Aids, which the mini comes with 1 pack. This comes with 3 packs. Okay. So if you use Band-Aids out of the mini, you could restock out of this one if you wanted to. Okay. So it just gives you more. That's everything that's up there, and these are removable. So if you wanted to hand this to somebody and say, here, I want you go ahead, I'm going to clean this wound, you go ahead and bandage that one.
I love that you can see what's in it.
Yeah, that was a big deal to me too, being able to see everything. And you'll see that down here when I open this up, it's the same deal. It's designed to really to have everything in your kit kind of laid out for you. It was very important to me when I designed this that we have a clamshell design. So I actually have a double clamshell design. First it opens up this way, and then it opens up this way, so everything's exposed. I can see, this is essentially my workspace. So if I'm taking care of somebody who's injured, I can have a workspace right here that I just work out of and take care of my patient. So down here we've got more wound cleaning supplies. We've got irrigation. So here's some saline. And then over here for your eyes, I mentioned how I don't include a lot. This is just to get started. So there's lots of ways to clean the eyes. There's improvised ways to clean the eyes. You can also just stick a head under a faucet, but there's lots of little tricks for taking care of lots of different injuries. So it goes back to the training, right? Learning how to use what's in this kit, but also knowing how can I improvise with what's in this kit? How can I make something else out of what's in here? What can I do with a ACE bandage in addition to just being for an ankle, right? So we've got ACE bandages back here. You'll recognize this, our OTC med pack, the over-the-counter meds. So there's 3 of those in here. So not only do you have your OTCs, but you also have the place where you can put your Jase case. And we just use this as a little placeholder so that you can see what goes in there. But SAM splint, triangle bandage, and actually I have 2 types. So this triangle bandage is just a basic, you could make it out of any kind of material. But I also included one of my favorites. This is a triangle bandage / burn dressing. So this is actually sterile. And if you've got somebody who has a burn, it's very important that you keep as much of the dirt and bacteria off of that burn as possible. So covering it with a sterile sheet is really important. So this gives you that opportunity to now provide sterility. Or if you need a second triangle bandage, you just open it up and you got a second triangle bandage. So it kind of satisfies two issues. Here's your dental putty. We've got your burn gel in a couple of different forms. And then,
what different forms do we have the burn gel?
so this one is just a squirt bottle of gel. And then you've got your burn dressing, which is located over on this side, which is there.
Which is huge.
Yeah.
Burns
and then,
are, yeah.
I also have some burn ointment, which is on this side. So there's lots of material in here to take care of burns. Your alcohol pads, mosquito repellent, and some Sting E's to just kind of take the irritation away. Your iodine pads, which can be used for making a solution or cleaning an area. On this side, we've got our topical packets. So this would be your antibacterial ointment. And then on this side, your wound closure strips, like we talked about before. This is also in the mini. And then we included a variety, just like the other one, except this one I have those. 3 of the zip stitches.
Love those.
So 3 big lacerations if you are that unlucky.
Yeah.
And then the Mastisol, which we use with the wound closure strips. So this is the glue and this is the bandage. So these are strips of fabric that they do have some adhesive on them, but they don't stick by themselves. So you put the glue on first, which also, this can also serve like super glue. So, and then you put this where you put the glue on and it will hold it closed. So great for in the field laceration care. And then your gel for blisters. So we got 4 of them in this kit. There's some eye protection in case you need it. Especially, this is really important if you're doing wound irrigation. So if you're in the field and you've got a wound that's really dirty and you're squirting water out of that syringe, it splashes everywhere. So yeah, keep your mouth closed. Ask me how I know.
Maybe we shouldn't talk about that right now.
But yeah, so it's useful. There's even some masks on the front in here. So you've got masks if you need them. And then, I forgot the one last thing, our Jase multi-tape. So I have duct tape gets included in every kit that I carry, and I can't tell you how many times I've actually used duct tape in place of everything else. I use duct tape for blisters. I use it for bandaging. You can fix things with it. So just having the duct tape around, whatever form, is super useful. So I've got rolls and rolls of it in my storage at home. So this is the Jase Medic. I don't think I've missed anything.
So, okay, a couple things that I love about this. I love, what did you get?
These are the ear curettes. It actually, these were actually, believe it or not, very hard to find. They're very expensive. So we decided to include them because I wanted them. This is and you can't really see it, but it's a looped ear curette for getting foreign bodies out of the ear. No, it's not for cleaning the ears. You should actually leave the wax. This is for if there's a foreign body in there and you need to get it out. You can use your otoscope and you can get in there and you can pull on the critter's legs and yeah. So very, very useful tool. And then I also included a few needles. So these are 18 gauge. Mm-hmm. And so I was asked, well, how come there's needles but there's no syringe? Well, what would you use this needle for if you had a syringe? Well, for injecting. Well, there's nothing to inject in here. So logic would tell me there's another purpose for these needles,
get
right?
A splinter out.
So yeah, exactly. These needles are actually awesome for getting splinters out. They're great if you're trained for getting foreign objects out of the eye, believe it or not. It's actually one of the easiest ways to get something out of the eye, especially if it's metal. But they're great for just getting small things out of the skin. And I use the 18 gauge because they can actually be manipulated. Smaller ones tend to just poke. These can actually be manipulated enough that you can actually use it as a tool. So I included 3 of those little tools in here as well. So it's little things like that I wanted to see in my kits, that if you get the knowledge, the equipment's there for you. There's scalpels. Well, I'm not going to be doing surgery, but say you've got that splinter that now went underneath the skin and you're away from medical care and you need to get to it. Well, you've got a sterile scalpel, so you could make that little incision if you need to get it out. And then you also have the Steri-Strip so you can close that wound back up. So little things like that there's not a lot. I don't have 10 of them in here, but I do have 4. And I do have enough Band-Aids that you can take care of a few wounds. And there is enough equipment that if all you have is this water to be able to clean a wound, well, there is enough here that you could fully clean one wound. So you're not having to carry around, a lot of these other kits have just piles of stuff that's just unnecessary, like the rope that was in the IFAC. What am I going to use that rope for? I'm not going to use, there's no need in a first aid situation to have, maybe there's some improvised things that I could use it for, but there's no need for me to have that rope in that kit. So if it doesn't need to be here, I got rid of it.
Okay, there's a few things that I really like about this. First, I love that the bag is really sturdy. Like this is rugged. I love its organization. But I also love that there's room to put other things that might be important to me and my family. I'm trying to decide whether I would rather have my Jase case in there or the trauma kit though. I've
actually heard that from quite a few people.
Because if I'm taking this, if I'm using it, my plan is to put this right in my hall closet where my evacuation kits are and everything that we would need to evacuate. So, what do I need more? Or maybe I just get creative and I'll have to put the trauma kit in my bag. But
let's tabletop the scenario. So, and here's the reason. This is what I tell people. If you want to put it in there, that's great. And for getting from point A to point B, that's fine. But I generally, and this is why I've been asked, how come there's no tourniquets in this kit? How come there's no hemostatic gauze? How come there's no compression bandages? This is not a trauma kit. Remember, my kits are purpose-built. This is a minor wound kit. This is a nosebleed kit. This is this is your doctor bag for home. If one of my family members, or me, for example, gets a wound that needs a tourniquet, and I have to, well, first I have to go to the closet and get it.
Very good point.
How long does it take to bleed out from a true arterial bleed?
Actually, that's a really good point.
90 seconds to 3 minutes.
Yeah.
So do you have time to get the hidden trauma gear? This is why I want this to be in everybody's car. This is why I want this to be not in some kit tucked away, but actually in a drawer in your kitchen or in the workspace or with my fire extinguisher, where everybody knows where it is and it takes seconds to get to it. That's where this kit belongs, where you can grab it right now, open it up, and apply whatever intervention that needs to be applied. I need at least 2 of them because I need one to stay there and I need one with my vac stuff. Well, I need 3 and I need one in my car. Well, and then you get down to, okay, well, gosh, that's an investment. It is an investment. Kits. So let's talk about that. I designed this to be able to trust everything that's in here. When we decided who was going to supply and what they were going to supply for this kit, we went through a lot of iterations. We went through and used and tested, and I took on deployments all the different components that go into these kits, and I put them through the test to make sure that I would trust it for me, I would trust it for my family, I would trust it for my patients. That's what ended up in this kit. So of course, at first we got cheap Asian gear that is just made to be sold on Amazon, nothing else. There's no like screening for whether or not it works. It was just, and it ended up being very cheap gear. So as we got rid of those components, of course the price started going up because you do get what you pay for when it comes to especially life-saving gear. You absolutely get what you pay for. And so that's why I caution people when they get online and they go to, I keep saying Amazon, but Amazon actually does have some good things too. But you go get the cheapest kit on Amazon, or you go buy one of the $7 tourniquets on Amazon. So when I went to Ukraine in 2022, I had been donated a whole bunch of tourniquets from a company that had gotten a whole bunch of tourniquets from China. We had tested them and thought they were okay, but we took them anyway, not knowing. And it was cold. It was March, and the windlasses on the tourniquets were snapping. And I was witnessing soldiers applying tourniquets and having the tourniquets break. So for me, that was life-changing. I decided at that moment that I would never use subpar gear again, that I would spend whatever needed to be spent on life-saving gear, which is why we chose to use the Snake Staff Systems ETQ, which is why we chose all of the components that go in this bag. If anything at any point failed or looked like it was going to fail, we got rid of it. So I trust all of these things. My friends that have tested these things also trust it. So we are putting our reputation on the line by saying that this is quality, and we'll stand behind it. And if at any point it seems like it's not the case, I will get rid of it and I will replace it with something else. I will put something better in this kit, regardless of how much it costs. And I was supported completely by Jase in that decision.
You know how much I appreciate that? I really appreciate that, because I'm somebody who doesn't know the difference in the quality of a tourniquet, right? And I wouldn't know until I'm put in that situation where I'm trying to save somebody's life, probably in my case, somebody that I love very dearly, and I need it to be good. I need it to be quality. I need to know how to use it, and I need fast access. You're awesome. You've done a great job, Aaron. Thank you. Thank you for being an advocate for all of us who don't have that experience and that knowledge.
Thank you.
So if you are interested in buying any of these Jase Aid kits, we'll leave a link in the description of this video. Also, if you use the promo code Provident10, you can save a little bit of money. You know, after having gone through these kits, I see there's some things that I thought I was doing right, that I needed a little bit of help. So thank you for that too, Aaron. But that's all part of this process, is we are working harder to get better. And as we look into the future, I see a lot of challenges ahead. And I also see supply issues. So right now, one of Jonathan's and my goals is to make sure that we have whatever resources we need so that we can do the best job we can to take care of our family and our neighbors. So thanks again. Super, super appreciate it, Aaron. For our audience, the question of the day today: what emergency items would you put on your wish list? Or what things have you used in an emergency that you would never want to be without because you realized how valuable they were? Comment below. And thanks for being part of the solution.